Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Azy and Dr. Arezoo Nasiry show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome back. Today we're going to talk about a very common question that we get asked a lot, which is when people have crooked teeth. What's the best way? Like, should they veneer it? What are some of the things that we can do for people who have crooked teeth?
So often we get people coming in saying, I don't like my smocks, my teeth are crooked, and I want to get veneers. Mm-hmm. And so there are some issues with doing that when your teeth are not in the right position. So the thing that I like to tell patients is whenever we're treating something, we want to look at the cause of the problem and resolve the cause of the problem instead of just veneering over everything.
Right.
Okay?
But is it possible to veneer it? Let's just start there. Can you veneer crooked teeth?
Technically, yes.
Okay.
I mean, you could. The issues that arise are that you end up having to cut into the teeth quite a bit.
Right.
So our philosophy here is, we want to be as non-invasive as possible, which means if we can do a procedure and remove as little of your own tooth structure, if not any at all, that would be best.
Right.
So if you come in and you don't like your smile because your teeth are rotated and overlapped, well, the cause of that is that the teeth are not in the right position. So the solution is going to be moving the teeth into position, which might be braces or Invisalign, which is how we prefer to do things here.
Okay. So if you have crooked teeth and you don't want to cut into your teeth, then the best thing is to do just straighten them and put them in the correct position.
Sure. If the structure of your teeth are nice, you like the shape of them and everything, they're just in the wrong place, then we need to just move them to the right place, and that would be the best answer.
Okay. So when would veneers be the correct answer?
Right. So then the opposite thing applies. If you are looking at your teeth and they are cracked, they're chipped, they're very discolored to the point where whitening may not resolve that for you, the shape, they're too small, then veneering them could be an added benefit. So generally we want to veneer, and a veneer is just putting a layer of material over the surface of your tooth. That's all that means.
Right.
But generally we want to veneer it if by adding to your tooth, it's going to make it look better.
We do actually a lot of cases here where we do both things, right? Where we first straighten it and then veneer it. Like, why would you do that?
Probably 70-80% of the cases where we do veneers, we have first done some orthodontics.
Right.
And the reason for that is that we want to put the teeth in the ideal position first. So again, we can be minimally invasive and just cover them. So if you come in and you have teeth that are really worn down, but they're also rotated. So that happens pretty commonly. People come in, they have a lot of crowding, their teeth are overlapped. And when your teeth are overlapped and you bite down, you tend to wear them at different angles because the teeth are crooked. So as you grind your teeth, they wear at all these uneven angles. They get chipped, things like that. So ideally then, we want to align the teeth, put them into position. And when I know that I'm going to veneer them after, I'll actually put the teeth in a position that then adding a layer of veneer to the surface of them will put them in the ideal place.
So you pre-plan the veneers kind of into the movement of the teeth.
We pre-plan it. We say, okay, ideally we want the teeth to be this shape and in this position. Where do I have to move the teeth into in order to achieve that? This creates the most ideal aesthetics because now all the gum lines of the teeth are going to be where we want. And also it's super conservative because I can actually tuck the teeth in. So then when you get the veneers, we're not really cutting into your teeth at all and the teeth are not going to look bulky.
Right. Something that happens a lot also is after getting your teeth straightened, it's as if they're more crooked. Talk about that.
When your teeth are overlapped, if you have a lot of crowding and they're overlapped like this and you're grinding your teeth, they wear at an angle. So, and then you straighten these teeth out and now all the edges of the teeth look uneven.
Right.
So we talk about that at the beginning. Sometimes that unevenness is really minor, like on the edges of the lower teeth. And after we do something like Invisalign, we'll go in there and just polish those little edges off. And that takes care of it, makes them all clean.
Right.
So when we're doing orthodontics, we're looking at the root angulations of the teeth. Are the teeth all straight in the roots? And if that's the case, then we manicure the edges of the teeth, basically. Sometimes those edges are really sloped. We will identify that at the beginning before we do the orthodontics and let you know. At the end, we may want to put a little bit of filling material on these edges or veneer them or whatnot to get the edges all straightened out.
Yeah, specifically for adults, I think, because you've had your teeth in that more crooked position for years, they're going to be maybe like uneven edges. And so at the end of straightening them, they're going to even look more crooked in a way. They're actually straight, but the edges look more crooked.
That's true.
Yeah, so it's a little bit like confusing sometimes.
It can be, but we'll have those discussions when you come in for a consultation.
Right.
And talk about, well, we're going to straighten them out. The edges are going to look like this, and we can polish the edges off at the end. Usually, 90% of the time, just a little polishing takes care of that.
Right. What are some of the other things that people should think about if they're trying to decide whether to straighten their teeth or veneer their teeth?
Veneers are a great option, but it comes with a lot of caveats. You have to have no cavities, right? You have to have a healthy dentition, and you have to have healthy gums as well.
And you have to have back teeth support.
And also you have to have back teeth support. So veneers are just the window dressing on your teeth, right? So I always put it this way: if you buy a beautiful ball gown to wear out to a party, but you haven't taken a shower in a week, then you're going to put that thing on, but it's not going to turn out very well, you know?
Right.
So you need to have a healthy sort of body underneath. So we always want to do an exam and take care of your gum health and any cavities that you might have to begin with. Then there's the structural component of that. So when we put veneers on the front teeth, and let's just back up a step here, our front teeth are supported by our back teeth. So we use our back teeth to chew food, right? And we use our front teeth to bite into food.
To slice things.
Yeah. So you move your jaw forward, think about biting into an apple, and then you move that morsel of food back and you chew on it on your back teeth. So if you are missing some of your back teeth, and then you want to just make your front teeth look good and veneer them, that can be a problem. What happens to people that don't have or are missing a few of their back teeth is they end up doing their chewing with their front teeth.
Right.
So that wears away their front teeth a lot. And then they come in and say, I don't like how my front teeth look. Don't worry about the back. Just make it look good.
Right. That's a common thing that is like you just want to fix your front teeth, but it's the whole thing has to work together. It's like a system, like a bunch of teammates working, and you're missing like half your team. Well, the rest of the guys can't handle it, you know?
And they're not meant to do that job.
They're not.
That is why probably your front teeth are failing and chipping and falling apart, because you don't have support in the back.
Right.
And so if we go ahead and slap some veneers on, it might look good, but it's not going to be lasting you a super long time, because the same thing that's causing the issues is going to continue.
Yeah, and those veneers tend to fail and chip and break and pop off because you don't have the back support, right?
Totally, yeah. So it's really important to see somebody that is going to take care of you as a whole person and take care of your whole mouth, rather than just window dress your front teeth and let you go. So that's why veneers, even though they can be a simple thing to do, actually require a lot of technique, a lot of thought, and looking at the function and the health of your mouth in general.
Planning the whole thing as a system rather than just dealing with a few front teeth.
And then that leads to the same issue with veneering your teeth when they're crooked, when they're in the wrong position. If we veneer teeth for that reason, we end up having to cut into the teeth. So imagine you have a tooth that's sticking out quite a bit and one that's in, and you're like, I want to make these look straight, so go ahead and veneer them. So we have to cut into the tooth that's sticking out quite a bit to make it look like it's coming in. So that's super invasive, often leads to teeth needing root canals and other issues. And then the support of the root of that tooth is not there. So when your tooth is sticking out, the root is going in the other direction.
Back.
So if you veneer it at a different angle, that tooth structurally is not as sound as a tooth that has its roots sitting right underneath it. It's like the root of a tree sitting right underneath
the tree versus an angle away from it. Yeah.
So you want to align your teeth so that you have the best support. So whatever you add to the surface is going to last you.
Right. People don't understand maybe like all that needs to go into it to give that final beautiful look. There's a lot that has to happen in the background as far as support, the angulation of the teeth. And what about the smile line? What about people who have like the gummier smiles?
Sure. Yeah. So gummy smiles can be from a number of different things. Sometimes it's because the teeth have come down too much. So if you look at people who bite down and you don't see any of their lower teeth. That means their upper teeth are fully overlapping their lower teeth when they bite, right? Like 100%. So we call that a deep bite.
Right.
And these people are often clinchers, right? And grinders. So they're grinding their teeth. They really bite down hard. They usually have like really square jaws, things like that.
Right.
And sometimes that's because of super eruption or overgrowth of the front teeth over top of each other. Now, they want to veneer their teeth to make them look good. They see a lot of gum line.
Right.
But the issue is that the teeth are just like too far down in their smile. So again, orthodontics is the answer to that. We want to pull those teeth back up. That'll reduce the gum line issues. And by the way, when you have so much overlap with your lower teeth and you veneer your teeth,
Right.
they're going to bump into the lower teeth a lot, and they're going to chip.
And they're going to chip for sure. Yeah.
So we want to bring those teeth up. So that's one reason for a gummy smile. Another reason can be that your whole jaw, the whole structure of your skeletal system of your upper jaw is further down, right? And often that requires some sort of surgery to
Right.
alleviate.
To really fix. Yeah.
Yeah.
But you can kind of mask it with orthodontics.
You can mask it. You can still raise the teeth up. So
Yeah.
ways that we alleviate that are sometimes we do a little bit of gum surgery where we lift the gum line up a bit. Sometimes that requires just removal of a bit of gum. We do it with a laser. It's very simple. Sometimes it also requires removal of a little bit of bone that's underneath your gums. That's a little bit more invasive of a surgery.
Right. To
Those
make
are
the
ways.
teeth look longer rather than moving the whole jaw.
Exactly, yeah. So often we do this when we do veneers. Sometimes we have gum lines that are just a little uneven.
Right.
One's a little bit, triangular, the other one's more rounded. So we sort of go and trim the gum tissue to make everything look symmetrical
Right.
before we do the veneers.
So just to kind of like give a wrap up, veneers versus straightening. Seems like straightening is always going to be the first step, right?
If the issue is the positioning of the teeth, yes. So a lot of people will come in and want to veneer their teeth when their midline is off center.
Right.
So your midline usually is right in the middle of your face where your nose is, and you come down and there it is. But some people have their midline shifted to one side.
Right.
So if we want to correct that with veneers, think about the amount of cutting we have to do. So if we want to bring this tooth over this way, we have to cut the other side of that tooth, and then the side of the next tooth, and the side of the next tooth, to make each of them look like they appear a little bit more to the right side of your face. And so that, again, is more invasive. It's unhealthy for your gums in
Right.
general, because you're going to have this kind of ledge on one side of every tooth.
Because again, the root is not centered to where the tooth is going to look like being. It's like it's on one side, so you have this whole thing sticking out.
Yeah,
The side of
exactly.
it. Okay.
So it's hard to keep it healthy and clean. And aesthetically, the gum lines aren't going to be super symmetrical, so it's going to be hard to make it look good as well.
Right, right. Okay, so I guess overall we would recommend getting the teeth in the right position first, having back teeth, and having healthy teeth before thinking about just doing the cosmetic slap-on veneers.
So, yes. So if you have your teeth in the right place, your gums are healthy, you don't have any cavities, and you have your back teeth
Yes.
to support, veneers can be amazing, non-invasive,
Yes.
super great procedure to do.
Yeah.
But the failures come when all of those parameters are not met
Right,
first.
right. And those can be a nightmare when your veneers keep popping off or chipping, and you're just so worried that all of a sudden you're going to lose a tooth. So it's not a good situation.
Exactly.
Yeah. Well, anything else you want to mention about this?
So a veneer consult is always a good idea. See a provider that does a lot of them, because when you have the experience of doing this, you see the pitfalls and the issues that
Right.
arise when you don't do it correctly. So definitely do your research. Find somebody that does a lot of them, and make sure they are looking at everything in your mouth and not just looking at your front teeth and going, yes, we can veneer them.
Right, right.
And then moving along. Make sure that they are doing a full exam and letting
doing
you
the
know.
full thing and letting you know. I hope that was useful.
Yeah.
Thanks for joining us.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.